So my name's Alison Cairns and I'm a renal home therapies nurse and I work in the renal unit in Untitled. My role is very varied. There's lots of different aspects to my role, but primarily I'm responsible for the care of those patients receiving a diagnosis of chronic kidney disease and then training those patients who decide to have dialysis within their own home environment. I came to the Trust 7 years ago and was delighted to become part of such a vibrant and dynamic team at that time, because we were all facing the challenges of setting up a new renal unit. And I was a haemodialysis nurse at that stage, and then it was 3 years ago whenever I got the appointment of renal home therapies nurse. That's a difficult one because every day is very different. Filled with plenty of challenges but lots of fulfillment. But typically I'm behind the desk at 8:30, and at that stage I'm really reviewing the diary and trying to get some structure to the day that lies ahead. I will be reviewing blood results and making notes of issues that I need to address with the consultants. It may be that I'm over in outpatients doing a clinic with the consultants. It could be a transplant clinic. The clinic will start at about 9:30, run into about 12:30, and then we will go into a multidisciplinary team meeting in the afternoon. I absolutely love everything about my job, but I guess sometimes the paperwork and the various meetings can wear you down, because it is the patient contact that gives me the real thrill and buzz for my role. The patients are absolutely fantastic. They allow you to become a very intimate part of their life and journey with them during their diagnosis of chronic kidney disease, and that's very humbling for me and very rewarding. It was about 3 years ago that I decided to set up a support group for these patients, and that all came from an idea that we had, that whilst we were good at the medical side of care and the nursing side of care, there was a gap, and that this gap could be filled by patients speaking to other patients. So what started off as a very simple idea has grown into something fantastic and very beneficial, and that is the Alton Galvin Renal Support Group. And 4 weeks ago we were absolutely honoured to receive the Patient Client Making the Difference Award. The award really signifies one thing: it allows renal patients to have a voice within the Western Trust, and that is something that we really value, and we can see the benefits of that within our renal service.